Hello friends, welcome to Sri Netralaya. In this very interesting case of long-standing corneal opacity, I did a anterior segment OCT and noticed this particular opacity is located in the anterior stroma, which can be removed with the help of Alger's brush. Alternatively, we can utilize excimer laser, but that is a slightly costlier option and Alger brush is a very good alternative cheap tool. Though in some cases excimer laser may work better to have a good outcome and to have a very good depth assessment. So let's do it. First, alcohol swab is utilized to loosen the epithelium and loose epithelium is removed with the help of slightly blunt instrument, and now we can see this corneal opacity is there in the bank center of this cornea and patient vision has dropped down to 3 by 60. She gives a vague history of trauma to this particular eye, though very specific reason or the cause for this particular corneal opacity is not known, and this particular opacity was unilateral. Once corneal epithelium is removed, I am using the Alger brush tip, which is having diamond dusted ball in the front, and this rotating diamond dusted tip will remove the corneal opacity very efficiently. You can note I have made the surface very dry so that it should take off the tissue which is located anteriorly, and along with this the corneal opacity will also come out, and this way I will get rid of this corneal opacity. And as the brush tip is not having any sharp edges, the trauma chances are extremely rare, though we have to keep watch on the depth we are going in, and intraoperative and preoperative pachymetry helps to decide to go for the depth we are targeting. The specific etiology of this particular corneal opacity was not known. She had a history of trauma in the past. She is around 47-year-old and this particular opacity was unilateral. So the chances of dystrophy or degeneration is less. The diagnosis for this particular case according to me was BSK, that is band shaped keratopathy, and in case of band shaped keratopathies these corneal opacities may recur, though I want to take the chance and go ahead with the removal of this particular corneal opacity. Once this corneal opacity is removed, in a dry state I am utilizing the saline jet to make the surface wet and see how much depth of opacity is remaining with the help of intra-op pachymetry, and one can visually notice that the corneal opacity has decreased much. Now I want to use the burr in a state of wet surface so that I will have more regular anterior stromal surface, and epithelialization of this particular surface will be better if the bed is smooth. Slowly I am moving this particular burr in whole of the area and avoiding to create any crater in the center. Once a fairly removed corneal opacity is noticed, a mitomycin is applied to the anterior stroma so that there will be less chances of reaction and the chances of recurrence of corneal opacity should go down. This particular case has improved from 3 by 60 to 6 by 9 after removal of this corneal opacity, and later date performed a phacoemulsification with toric IOL implant. The chances for recurrence cannot be ruled out in such cases, though we are having a good follow-up of this particular case, and till now the case is doing well 6 months down the line. Hope you like this particular case. Thank you and good day. Do subscribe to a YouTube channel Dr. Pankaj Lande for more such exciting videos.